Hey ladies and gentlemen, this is your sister B Fela talking. Don't mind us, we are just in a tent because we are doing an outreach program here in Kapok. That is one of our services that we provide as a government clinic. Today as us, I'm going to talk about UTI, but I'm going to do it with a bit of zest, whereby I'll be comparing UTI and Candida infection. As I've seen most of you, it confuses you a bit. You think that you have UTI, what you have is actually what we call Candida infection. So I'll start first with UTI. What is UTI? UTI is urinary tract infection, whereby it's an infection that affects your urethra, your urine, or your bladder, in extensive cases your kidney. So whereby anything that involves umkhamo, moroto, urine, meaning your urine, the symptoms could be a bad foul smelling urine esang monate, because hona le smell sa urine se leng gore se tlwaetse, and then ya how fetsa ruta wa utlwa man moroto ona it's too strong and it's too cold. You might have a urinary tract infection, and then this urine, what happens to it, it might have a burning sensation, or you still feel like you still need to pee a bit more, or you have restrictions when it comes to meaning limited. So that's when you know you actually have signs of UTI. It doesn't involve your discharge in most cases, it only involves your urine. So that's one of the things, that's why the highlight is urinary, because of it's only urine related, and it only affects your urinary system, which is your bladder going into your kidneys, and then everything that goes into your urethra, meaning that is the passage along moroto ofita ka yona, and then it also involves your vagina, because of moroto ofita montweng na mo kukung. So how ka utlwa o chiselwa ha o rota, then it's possible that you might have urinary tract infection. It affects both male and female, meaning that it affects both banna le basadi, so it's not gender specific. The treatment for urinary tract infection, diagnosis, let's start with the diagnosis first. You get diagnosis urinary tract infection via urine dipstick, which you can get ko clinic her testa moroto wa hao. So all the time ko clinic he ba re ko wena re kopa o re le ko toilet o re tlisetse moroto, or hambe toilet o slethele umkhamo sifuna test umkhamo baba, or sifuna test umkhamo mama. Don't be alarmed ucabanga ukuthi bafuna check ezinye izinto ongazazi. Most of the time it's related to that. That is when they get a proper diagnosis urinary tract infection. How do we treat urinary tract infection? In intensive cases, we treat urinary tract infection only exclusively by using antibiotics by a prescribed healthcare worker. Unfortunately, for reasons you guys like to buy over-the-counter medication, I feel like I cannot really specifically say which medication should you take for urinary tract infection. So it is best for you to go and consult so that you can get those antibiotics specific for your urinary tract infection. But most of the time with urinary tract infection, it involves water. So how's your water intake? Are you taking 8 glasses as a normal person should a day, or are you taking less? More is not a problem, but less is actually quite a problem. Also remember, the usage of public toilets is not only about public toilets, but also the toilets that we use at home. Are we cleaning and disinfecting them accordingly? Because remember, sometimes we'd be thinking because the infection is not there. Can't somebody in the house, especially people who live with men tend to urinate on the seat and not wipe it. So it is important that wherever you go, whether it's public toilets, whether it's the toilet at home, please try to disinfect the seat by using your 97% disinfectant. Sometimes sanitizer. You can sanitize your seat, or you can just wipe it with a tissue and then udule fati. But most of the time, especially for women, we encourage limit your sitting on the toilet, especially directly, more especially in public toilets, or the toilet is flashing, or the toilet is mobile toilets. So we encourage you all the time, at least you have some wipes, and then wipe the toilet, and then before usage and also after usage, so that the next person, if it makes it easier for them not to contract that infection. So with urinary tract infection, most of the time there is no treatment at home or a home remedy that you can do to decrease or to eliminate the symptoms. So like I said, it's antibiotics that could only make you feel better. Other than that, there is literally limited things other than water that you can take with urinary tract infection. Going to Candida. Candida is a fungal infection that is common in women, whereby you get because of our diet. Most of the time as women, things that we eat, they already have this thing called yeast inside that they use to grow whatever food that we are consuming as women. So it's very rare, but it's too much because of this yeast now goes straight directly into the reproductive system of the woman. Foods like your potato, how limutara and the chips whether the braille, the chips whether the chips like the zimba, they also have yeast, and then too much of that could also increase your candida infection, your chances of having candida infections. Things like the scopas, your popcorns, maize meal, because it's made out of yeast. Those things, they contribute too much to you having candida infection. Candida infection is not sexually related per se. It is something that it happens, I could actually say, naturally, because all women do have fungal in them. There's the thing discharge. So what are the signs and symptoms of your having a fungal infection? You will see a white cheesy like discharge. Sometimes it is smelling, and the smell becomes so offensive, and then sometimes you get that your labias, the outside of the vagina, not the inside, it becomes itchy at times, and this itchy and just scratch, and just keep on scratching, which makes it a bit easier, but it makes things worse when you scratch. So treatment ya candida iba ing. Like I said, candida is not sexually related, so you can't get it because of you slept with somebody usai berekisi protection. That one is completely different because of the STI. I understand. So it happens from time to time that sometimes after your periods you can get a candida because of no bleeder, and then it doesn't naturally go away. So Leona, it has things that you can do at home to help. If it gets worse, you can go to the clinic to get your antibiotics. If not, you can also use your antifungal ointment that you can get over the counter or by a healthcare facility. You use it for 7 days, not more than that, and then with the antibiotic, and then to add on that, you can also increase your intake of cranberry juice, and then you can also increase your intake of strictly plain yogurt, whether it's double cream or it's a single cream, it's still fine, but the more intake you have, we don't recommend the usage of plain yogurt under the cake, because remember, the cake is very sacred, so anything else amayang body should be that thing merengis. But you guys tend to also insert things that are not supposed to go down there, like your douching, like things like that. They put you at risk for this kind of candida infection, and it becomes very uncomfortable when you have to have sexual intercourse with such an infection, because of, remember, down there already you're not smelling nice, and then the cheesy thick discharge is not nice for the guys to see. I understand. So we try by all means, for at least before you go and have your sexual intercourse, couple of days before, increase your cranberry intake, whether it's cranberry juice, cranberry fruit, dried cranberry, or anything that has cranberry. It can help you a lot to clean and to cleanse out the womb as it is. And also you can increase, if you can, add some plain yogurt on your breakfast or whatever that you feel like you can add your plain yogurt on, and then it works better. I hope this information helps you guys a lot, and if there's anything that you feel like it is too much for you, please guys, I encourage every one of you to go and consult by your healthcare facilities. And for those who think that who complain that they have bad services by their health facilities, do not leave your health facility without reporting such services, because now it makes it very difficult for you to go back and receive a follow-up and receive whatever that is health related. Thank you, and I hope this information helps you a lot. Thank you.